All right, everyone. So we'll go ahead and get started. This is over chapter 5, medical terminology. I want to say this is a challenging chapter in the fact that there's not a lot written on it, but if you don't understand medical terminology, you'll find yourself struggling in medicine. Unfortunately, the terminology and vernacular used in medicine is complex. Now, the good thing is it's based off of Latin and Greek. So if you speak Spanish, you're probably going to do pretty well at this. And so is English. English is based off of Latin and Greek. But you'll see that there's some overview, like oversight on some of these words. The first one that like comes to mind is like coronal, right? So like the coronal section of the brain. And I might be able to tell you in this lecture, oh, when you hear coronal, think of a crown, right? And that's what they're talking about. So that's where I'll get at. There's going to be some overlap on some of that, but the hard part of this chapter is it's a lot of information. So don't just breeze past this and leave this chapter not knowing the difference between hyper and hypo, intra and inter. You know those things, lateral, midline. You have to know that. Okay, this doesn't go away, right? This isn't like, oh, I got a 98 on my quiz in chapter 5. I'm good. No, it keeps coming up. Okay, so you actually got to know this pretty well. So we'll go ahead and get moving. Here's the deal. Medical terminology is used in virtually everything that we do. Okay, hypertension. You know, a very benign word that we use a lot. It means something, right? Hyper, above, and tension, the tension within the vessels, right? So it means high blood pressure. So where I'm getting at is there's it's used a lot, okay, and it's used so often you may not like. I'll give you another example: thermometer, right? Temperature measurement, a thermometer, right? So they're used a lot, and even in daily stuff that you may not have even realized before. But you'll see, like there's we use some of these words in modern day life, outside of medicine. So here's the deal: you got to know medical terminology because using medical terminology incorrectly can lead to wrong diagnosis and treatments and interventions and misunderstandings, blah, 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 blah. So it does become valuable. Now, here's how this is tested. Okay. It's fairly rare for the National Registry or for even in class exams outside of this like quiz you're about to take to say, what does hypo mean? Yeah, like it means below, right? Or under. Or like low. And that's not really what they're interested in. What they're interested in is when they give you a vignette, a clinical scenario, and they say, and you have to know that the blood pressure of 80 over 50 means hypotension, right? So what I'm getting at, or they'll say the patient has hyperglycemia, which means above blood sugar, like high blood sugar. So you have to know, oh, the patient has high blood sugar. They could have diabetes. So what I'm getting at is you have to know those things, and that's what how this is tested. Typically, um, you might occasionally see questions that I just talked about, but that's how this is tested. You have to understand medical terminology for the rest of this course to be able to get the right answers. So that's kind of where I'm getting at with this. Okay, now there's like apps and stuff like that, and those can be useful to try to figure out like you know different phrases and stuff like that. But Google's a powerful tool too, so I just use Google over an app personally. Anyways, now, like I said, most of these come from Greek or Latin words, but the good thing is so does English. Okay, so there's you'll see a lot of this. We use a lot of these words in modern medicine, right? Like in modern life too. So if you speak Spanish, and I doubt you speak Greek, you're in pretty good shape usually with these. They're very similar. Now, an eponym, we don't use these a lot anymore. In fact, things that were once called eponyms are now going away, but they're renaming them. So what happened was back in the day, if you like discovered a disease or like an apparatus or a medicine or I don't know something, they would out of honor would name it after you. But what's happening now is they don't do that anymore. They tend to just call it what it is, like microscopic polyangiitis, right? They instead of calling it church strauss, you know, like they just name it after what is it really. So that's helpful, but here's where this becomes difficult. Is it used to be those names are still thrown around, right? So I'm just using like a complicated diagnosis, Church Strauss syndrome, right? That's still thrown around, but you have to know the actual word for it as well, okay? So there tends to be both, and again, something named after someone, usually in like who first described it or discovered it, it's called an eponym, okay? Now examples are like something like McBurney's point, for example, right? So like McBurney's point, you take the umbilicus and the tip of the pelvis and you divide it into thirds, so like one third, two thirds, three thirds. And at this first third right here, that's where your appendix is at. And if you've ever heard of appendicitis, this is where your appendix is at, okay? So that's like an example. A Foley catheter, you may have heard of like an indwelling Foley catheter, right? And this is a little tube that goes inside the penis or and into the bladder. And then there's a balloon that inflates on the end of it, and it draws urine out of the bladder. It empties the bladder. And that was named after Mr. Foley, right? So it's named after people. But it's annoying. So where I'm getting at is some things are still named after people. Some things are changing. The changes are happening like now, like right now. Like when I started medical school, we did not call it anything other than Church Strauss. When I took my U.S. medical licensing exam, they were no longer calling it Church Strauss on the exam. So I had to adapt. That's just one example. Okay, so moving forward, there's these things called homonyms, right? And if you know what the word homo means, it literally means same. Okay, so homonyms mean this; they sound the same. Okay, so a homonym could be like dysphagia with an S, which happens to mean speech that is like slurred, versus dysphagia with a G. Oops, I'm an idiot. That's supposed to say G. Whoops. Dysphagia with a G. That is swallowing, right? So a patient that has dysphagia with a G, okay, that would be difficulty swallowing. You see that a lot of times, like post-stroke and as people age. But I remember dysphagia with an S is speech. Dysphagia with a G, gulp, right? They're swallowing and they can't swallow because it's dys. Dys means you can't. So that's just an example, okay? Antonyms, these are like opposites, okay? So an antonym's not like hyper, hypo, right? That like they're opposites of each other, okay? And synonyms, these are, you see this a lot in medicine, so it kind of makes it complicated. But these are like the same thing, but different words. So I'll give you an example, like it would be synonymous or a synonym to use the word nephro versus reno. So you could be like, these are nephritis versus I don't know, renal hypertension or reno, right? Like they're interchangeable. They're both talking about the kidney. Okay, they're talking about the same thing. But that's what I'm saying is sometimes in synonyms, a root or a prefix or a suffix, they can have the same or almost the same meaning, but they don't sound anything alike. Like reno and nephro both mean kidney, but they're not the same thing. They don't even sound alike. So those are just some examples. Now, moving forward, they want you to know this whole prefix, suffix, root, all those things that we thought we didn't need to know since past like fourth grade. Shocker, we do. Okay, I know. It's annoying, but we can work through this. It's not too hard. Okay, it's fourth grade. Now, prefix. So pre means before. So you're before fixing the word, right? So it's a prefix, right? So it generally begins at the beginning of the word. Okay, so a prefix is at the beginning of the word. And it describes a lot of different things. Okay, so it could be the location or the intensity or the color or whatever. It could describe, almost anything. And it could be used again to talk about time or quantity or a number or so whether it's triphasic or quadriphasic or it's hypochromatic, hyperchromatic, like whatever you're coming up with, those are examples of prefixes. Okay, now there's some examples here, and you actually need to know these. Maybe not like every single one and be able to like spit them out, but you'll see that a lot of these words we use a lot in modern day. Like we use these. Let's just look at one right here, like circumference. Okay. So if I tell you someone has a circumferential burn, we're talking about all the way around the burn. Okay. Or, hyper. It means above or excess. If some little spoiled little kid is hyper, right? They're they're in excess. They have too much energy, right? So that would be an example of that, or, I'll give you a weird one, paramedic. Right? Para literally means next to. So oddly enough, when they name paramedics, it's like literally means next to medical. I know, kind of not cool, but that's how it got its name. Trans. Okay, that means to go across, through, or beyond. Okay, there's just all these different examples. You'll see these a lot, not just in medicine. So I think if you look through this list, you'll be like, Oh, I've heard these words before. They're not hard, but we have to know what they mean when we apply their context to medicine. That's the hard part, is applying them to medicine a little bit, okay? So those are prefixes, and then suffix is appears after the word root, okay? So I feel like these slides are out of order, but it's okay. A suffix is like at the end, okay? So I'll give you an example. There's this condition called hematoemesis. I think it's right here. Yeah, right here, this one. Hematoemesis, right? It literally means vomiting of blood. Okay, and how do I know that if I don't know what hematoemesis means? I know that hemat or hema literally means blood, and emesis means to vomit. So blood, vomit, and I have to put those words together. So again, all the way through paramedic school, all the way through medical school, I am a big fan of when I don't know what the word is, I just stop, I take a deep breath, it's all going to be all right, and I start breaking down medical words that sound really complicated, like, cholelithiasis, right? Or, dysdiadochonesia, or weird words like that you don't need to know. And I'm like, what? I got to figure out what that means. And that's how I do it. So you just break down the words, and this is why medical terminology is important, because even in medical school, right, all the way through EMT and paramedic school and nursing school, or whatever you go, pharmacy school, whatever you decide to do, veterinarian, you're going to have to use these words. So again, when you find a word you don't know, just break down. And you might only know that the word, if you don't know what hema means, you might know for sure that emesis means vomiting. So you can at least be like, something about vomiting. Let me see if I can't find some more context clues in this question to figure out what they're saying. So you may not, especially starting off in this, you may not know all of the answers, and that's fine. That's okay. We don't want you don't, it's not expected you know everything about medicine. But don't panic on these. I see students just get super panicked and shut down, like, oh, I don't know what hematemesis means, and they just give up. Don't do that. It's okay. Just break down the words. If you know one or two pieces of the word, but you don't know the last or the third part, it's okay. You know most of the word. You're going to get through it. Okay? Now, um, root words are basically, it's like like as the slide says, a basic meaning of the word, okay? And it's usually like to describe a body part, and it can be also used to describe like color, like albinism, right? Ism means to like have an albino, literally means to be white, and those are like either Latin or Greek, I don't know, words that's where that comes from. Like like cyan, right? The color cyan, if you ever like had to change color or printer ink, it means blue. So cyanosis is to have bluish colored skin, okay? Um, so there's different words and there's different ways that these appears. Again, it's not like super heavily tested on the word itself, but they do show up in vignettes. And if you don't understand the vignette, you're not gonna get through the question. By the way, when I'm saying the word vignette, I mean like a clinical scenario, like 32-year-old female ejected from a vehicle, snoring respirations, blah, 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 blah. What do you do next? The whole 32-year-old female ejected from a vehicle, snoring respirations, that's called a clinical vignette. It's like a story. Vignette means story, okay? So I throw that word around sometimes. That's what I'm talking about. Now, we combine words, okay, and that's fine, and they give an example of like osteopathic, right? So osteo or osteon literally means bone, and anytime you see the word pathy, it means pathology, and pathology means something that is wrong, like disease, disorder. So that's an example of how we get osteopathic, right? So it's pathology relating to the bone. So that's kind of an example of how this works. Okay, it's not too complicated, uh, but it's foundational. And here's some really good examples, right? So an electro, okay, so we're talking about electricity. Cardio, definitely the heart. Gram means image. Instagram, right? It literally means instant image. Okay. So electric heart picture. That's an EKG. That's where we take pictures of people's hearts. You see what I'm saying? So you can just add it together, okay? A thermo, that sounds something to do with temperature. Meter, to measure of, right? So the measure of temperature, thermometer, right? Same thing. Osteo, arth, right? So it's osteoarth, right? Is referring to the bones, specifically the joints. Itis means inflammation of, okay? So, inflammation of the joints and bones, osteoarthritis. So that's where these words come from. These are very common examples, not very difficult. But again, you see where I'm getting at. If you don't know what electro means, but you know that cardio and the Instagram mean pictures of hearts, you might be able to deduce that electro means electricity. So you see, that's how I use these. Okay. Now, I think this is a little overkill, but I put it in here. Okay. So these are talking about plural endings. So what's annoying in English, we just like to slap an S on it at the end to make it plural. They don't do that a lot in medicine. Okay. It changes the whole word. Okay. So like vertebra is a single vertebra versus the vertebrae means plural. And it changes the spelling of the word and the pronunciation in some cases. Diagnosis versus diagnoses, right? It changes like the word, right? And I know that's very close. It almost sounds like a homonym. But, like I'll give an example. An apex means like a point, okay? Whoops, point. Versus apices means points, plural, okay? Ganglion is a single nerve, or it's not really a nerve, it's a piece of a nerve, versus the ganglia, right? It's a bunch of them. It's more than one. And the bronchus is a single bronchus. It's in our lungs. Versus the bronchi, a bunch of them. Okay? So you see there's plural endings. That's how this kind of works. Now, moving forward to, so that's kind of like the beginning medical terminology, but moving forward to topographical anatomy. That's why I have my camera on for this episode series. So basically, if you know what a topographic map is, it's measuring like in different layers. Okay, and we actually have to know these because this is used a lot to describe where injuries are in the literature. I'll give you an example. Say someone has an injury to their, I don't know, I'll just point somewhere, like here, right underneath my eye. You could say it's under the right eye. This camera's backwards. The right eye. And in common English, that would be like acceptable, but it's really not quite appropriate, right? What I'd have to say is I would have to say that, there's a 1 centimeter laceration with no active bleeding that is approximately 2 millimeters wide. And the location is going to be, just lateral to the zygomatic process on the right. Okay. So it's just lateral to the outside of the zygomatic process, which is this thing I'm touching on the right, and it's the patient's right. Okay, so it's always the patient's right when we're describing it. And it's really difficult sometimes because you look at a patient and your right is really their left. So do keep that in mind. It's always the patients that we're talking about. And I want you to know how this lady's standing too. This is called anatomical position. So anatomical position is facing forward, palms out at your side, feet facing forward, you looking forward. Okay. The big thing that students miss is the palms face forward. Okay. And that's anatomical position. So when we describe someone, this is the default position we have to work off of. It's called anatomical position. Now, there's different cuts that we do through the body to try to figure out what are we looking at. Okay. So I'll go through these real quick. We'll just go through cuts real quick. I'm sorry. One cut is the transverse or axial plane. Okay. So if we were to transverse the spinal cord, you're going to cut the spinal cord completely, right? From this direction to this direction, left to right, okay? And that's what they're showing here, right? You can imagine this purple thing went straight through this lady's spinal cord, okay? That's a transverse section of the spinal cord. Versus a sagittal cut or a lateral plane cut goes like this way. So this is up, down. Transverse, left, right. Sagittal or the lateral or the midline, it's up, down, okay? And then another example is like the frontal or the coronal plane. This is like cutting you like this way, like that. I mean, you can see it on these pictures. I don't know why I'm showing you that, but anyways, that's examples of different cuts that will occasionally be asked, or what type of plane are we looking at? I'm calling them cuts. They're really planes. And then there's a couple other examples, okay? So lateral. So lateral is to the outside. And how I remember this is, lateral, right? Making L's out here. Lateral, okay? You can make an L with your arm. I don't know. Lateral, okay? So it's lateral. And that's kind of what we're getting at. And versus the medial, it makes sense if it's the medial, it's in the middle. It's in the midline, okay? you know, I'll keep going. Dorsal, right? If you've ever seen a shark, where'd I put my pen? You know, if this is a, whoops, not a good drawing. This is a shark, and this is their dorsal fin, right? This is their little scary, uh, whoops, this is their scary little teeth. But if this is their dorsal fin right here, that's on their back. So dorsal means kind of like back. Or the other word for this in medicine is posterior. Okay, posterior dorsal. You know, the front is anterior, so it's up front. It's anterior, and I'll explain why these matter. Okay, excuse me. Why these matter is if you know, there is a I don't know, piece of rebar sticking through someone's chest, and you have to describe where it's at. You can't say it's in front of this and behind that. You would have to say it's anterior to the, you know, mesenterium, but posterior to the, you know, the visceral layer or whatever. I'm just making stuff up. That's kind of why these become important. They become a lot more important in like surgery medicine and stuff, but we still use these terms. So again, I don't want you to think I'm never going to use this. You do. I promise. You actually use these terms. They do pop up a lot, like every day. Okay. Now, I think yeah, we'll come back to this whole stuff. But there's different body cavities. I wouldn't spend a lot of time on this, but I know I'm telling you not to study it. It's what's going to show up on your exam. But there's two different ones. Okay. The first one is the dorsal cavity. Remember, dorsal, like a shark's dorsal fin on their back, the little thing that sticks out of the water. It's the cranial cavity, so like your head and the vertebral cavity. That's your dorsal cavity, okay? And it's literally a cavity. A cavity means all, like a cavernous, like a cave. Um, and then there's this other thing called your ventral body cavity, and so that's like kind of like your thoracic cavity. So this has like your guts and your heart and your, you know, your lungs and your liver and all that stuff. And really, within the ventral body cavity, it's divided in two at the level of the diaphragm. That's the muscle that helps us breathe. And it separates the thorax from the abdomen. So that's kind of where we get that from. So that's just two different body cavity examples. And then moving forward, we need to talk about medical terminology in terms of direction. This is used a lot. So for example, if someone is injured, right, to their, this is my left, to their left here, I don't know, they have a gunshot wound here, okay? And you have to describe that. How do you describe that, right? So what I would have to say is, remember anatomical position, I'll draw this on this patient. He's shot here. I would have to say that he has, you know, a 1-inch wide gunshot wound with an entry wound to the anterior forearm, just distal, you know, or just distal to the, or I'd say, you could say 6 inches distal to the elbow, okay? So what I just said was it goes here and it's about 6 inches distal, and that's where they would find this. So you're almost like providing directions like on a map with like where are they injured, where are they hurt, and that's why this becomes important. You know, you could almost say the same thing to say, you know, a 1-inch gunshot wound just proximal to the, about 1 inch proximal to the wrist. So proximal means above. So like that's an example, okay? So let's talk about what this whole proximal versus distal stuff means. We'll just start with that, okay? So the term proximal and distal is used on the extremities. And proximal means closer to. So my elbow, let me stop. My shoulder is proximal to my elbow. So my shoulder is further proximal, it's more closer to my central cavity than it is my elbow. And that sounds confusing, but I think it makes more sense hearing it the other way. If I say the patient's wrist is distal to their shoulder, I like to think I'm traveling the distance down the extremity, and that will get me to my distance or to my destination. So remember, distal distance, you're traveling, okay? And this only works on the extremities. So you can't use the word proximal distal typically on like this area. You can't do it, okay? It has to be on the extremities. Usually for our intents and purposes, in EMT school, it's the extremities. So that's one way to remember that, okay? So, you know, on a quiz, I might say, in relation to the elbow, the wrist is located blank to the elbow, right? So you would say the wrist is located distally, because you're traveling the distance, to the elbow. So that's how that's tested. That's how that would be asked, like on a quiz. That's how we use those words. Now, the word posterior, right? So we'll talk about this whole anterior posterior thing. Posterior means the back. The other word for that is dorsal. And anterior means the front. Okay? So it means like this section, the front. And that's how we use that. So, you could use words like, the patient was burnt to the anterior thorax. Okay? And so that would tell me as the paramedic or the EMT, they were burned to the front of the body, of the thorax, not the whole thorax. Okay? So that's one way we would use that. Now, another way we use this is inferior and superior. So if someone's inferior to you, they're below you, right? They're below you. So inferior means away from the head. They're below you. They're down, right? So I could say, the knee, or that's not a good example. I'm sorry. The belly button is inferior to the breast, right? Like that's an example. Okay, it's below. And superior, if someone's your superior, they're above you, like your principal or whatever. They're above you. So superior means up to be a higher above. So I could say the eyes are superior to the nose. Okay, like that's an example. And then remember the whole midline medial thing, right? Medial means midline, right down the middle, smack dab in the middle. So how I would describe that is, if something's closer to the midline, I would say, it's located medially, okay? And then a better example is like you, as an EMT, you will give epinephrine, and we give epinephrine in the lateral thigh. Well, you have to know what the word lateral means to give this medication properly. And the lateral thigh is located here, right? So it's the outside chunk of the thigh. It's the outside, lateral. Remember, like loser, right? Out, it goes laterally, okay? So it just goes out. And that's one way to remember that. And I still use these, like, I have to, like, really, especially in like a problem, like a test, I have to like really think there and kind of close my eyes sometimes and kind of like draw it out on myself, figure out where are they talking about with this pathology, like where is this question going. And one thing the National Registry and me as your instructor cannot take away from you is you. I can't take your body away from you. So if you're sitting in an exam and you're like trying to figure out what's lateral to this and medial to this, that's fine. Go for it. That's fine. I encourage you to do that if you need to do it. So do it. Use your body if that's what you got to do to get through these exams, okay? It's okay. It's the greatest cheat sheet you have, your own body. We can't take it from you. Now, moving forward, we're talking about like movement and positional terms. So flexion, if someone's like, oh, bro, flex your bicep, they flex, right? They bring their arm in, okay? That's flexion, okay? Same thing, if I were to flex my neck, flexion. If I were to extend my neck, I would bring it back, okay? So those are examples of flexion versus extension. Now, where this gets confusing is like students tend to not struggle with the whole flexion and extension stuff. Where they struggle is the abduction, adduction shenanigans, and I'll explain how this works. If you add ADD, look, add something to your body, you're bringing it to you. If you add something to your body, you are bringing it to you. So adduction would literally look like this. I'm bringing it to my body. So adduction is quite literally, not a trick here, adding it to your body. And how you have to remember the other one is it's not. Abduction is taking it away from your body. So you're abducting, I'm bringing up. Abducting away from the body, adducting. I'm adding it to me. I'm bringing it to my body. Okay? One way I remember this is like if you go to the gym, right, and you ever do like deltoid raises, you really have to engage your core, and it's like totally lightweight and almost humiliating. Like doing 15-pound like delt raises, and I have to engage my abs to be able to successfully abduct my arms, right? So in order to sit there and go like this and like raise up some weights, abduct the weights, right? I have to use my abs. So that's how I remember it. You may just remember quite simply ADD, adduction is when you add it to your body. Okay? So they show you this picture. It's in your book. We'll talk about it. This is normal. This is flexion of the neck. This is hyperextension of the neck. My handwriting's bad. I do apologize. So that's examples. Okay? Not really interested in going further on that. Now, Um, Hyper, again, means like in excess or above. Okay, so hyperflexion would be something like really flexing in your arm, versus hyperextension would be like really stretching my neck back. Okay, um, I love these words. Okay, supination, pronation. It scares students. They're not hard. So if I said, "Hey, student, you want some soup, but you don't have a bowl," you gotta go like this with your hands. Give me some soup. And that's supination. Supination is like this, to make a soup bowl with your hands. Okay? Supination, soup bowl. Supination, soup bowl. You're making a bowl with your hands. Okay? That's supination. Versus pronation, I like to think of like a pro that's like get back, right? So pronation is to extend out your wrist like this, like to push down. Okay? So supination, I'm a pro, don't touch me. So pronation, that's kind of the two between those. Supination, soup. Remember that, okay? Now, internal versus external rotation. You don't need. I would say you don't need to know this, but it's not really used a lot in emergency medicine. This is more like shoulder injuries, really, knee injuries. But if someone has a hard time my camera. Um, my camera's backwards, so forgive me. If someone has a hard time with like external rotation of the shoulder, it would be like this. I'm externally rotating. I'm taking it externally. Versus internal rotation of the shoulder would be bringing it like this. That's not abduction, abduction. This is abduction versus adduction, adding it to my body. There's a difference. Rotation is like this. Okay, so there is a difference. I just kind of want to show you an example of that. But again, when you're lost on the test, just use your body. It's fine. Can't take that away from you. Now, some words that are very, 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 very important that you have to know is the word bilateral. Okay, so bi means two. Bicycle, two cycles, right? Two wheels. So bilateral means it literally appears on both sides. So I'll draw this for you. Here's your, oops, that was a bad drawing, sorry. Here's our patient, okay? Here's his extremities, here's his head. If he has bilateral gunshot wounds to the knees, he has a hole on not just his right knee, but his left knee in the same place. That means it's bilateral, it's on both sides. Now, comparatively, if someone has unilateral, uni means one, like a unicycle, like a unibrow, right? One. So uni means one. So what happens in unilateral, it's only on one side of the body. So you could say, unilateral facial droop, unilateral deformity, whatever. It means on one side. Now, the word ipsilateral means on the same side of the body. You really hear this thrown around a lot in like spinal cord lesions. So I could say, patient has ipsilateral loss of sensation on the right side. It literally means it's on the same side of the body. Okay, so it's only on the right. Now, the word contralateral means it's on like contra, the opposite of. Like I hate to contradict, like I hate to say the opposite of you, but contra, opposite side, literally means opposite side. So opposite side of the body would be like, contralateral. Oh gosh, I don't know. An example is like, you don't need to know this, but if someone has like a right-sided stroke, they have contralateral weakness. So if I have a right-sided stroke, I have left-sided paralysis on my body. So that's an example of contralateral. Okay, it means the opposite side of the body. I know that's weird. It's not the greatest example, but forgive me, I'm doing this live. Now, you got to know these terms. These show up a lot. Like this isn't even like sounding sophisticated, being fancy stuff. You got to know those. Now, moving forward, there's different quadrants of the abdomen, okay? Now, there's the right upper quadrant, the left upper quadrant, the right lower quadrant, the left lower quadrant. We're going to talk about what all lays in these quadrants some other day. I love GI pathology. I'd love to explain this to you, but not today. It's coming up. But you have to know that we do divide the abdominal quadrants into quadrants, right? Quad, four, like a quad, like a four-wheeler. Quad means four. What happens is we use this to describe pain. So the patient could say, I have right upper, or not the patient's going to tell you this. You're going to be feeling on their belly and they're like, ooh, pain right there. So the patient, you're like, oh, wow, right upper quadrant pain in a 40-year-old female on birth control? That's probably cholelithiasis, right? Gallstones. So you have to know, as the EMT, what sits in the right upper quadrant and what pathology it likely is. So we use this a lot, a lot. And then, another example. Someone has right lower quadrant pain. Remember whole McBurney's point thing that I was telling you about? And eponym, that's something that's named after someone who originally discovered. We take the tip of the pelvis here, and we take the belly button here, and we draw it into thirds. Well, I'll be dipped. If in the first third, that's not the appendix, and the appendix can get inflamed, and it can cause appendicitis. So if someone has right lower quadrant pain and they're a male, we would think that, hey, this might be appendicitis. If someone has right lower quadrant pain and they're a female, let's say 25 years old, you might think this is an ectopic pregnancy or an ovarian cyst or an STD or appendicitis. You know what I'm saying? So there's a lot more diagnosis with females usually with abdominal pain. Abdominal pain in females is complicated. Anyways, so that's quadrants, okay? Quadrants 4, okay? Now there's this other system where we can divide it even further. You don't see this a whole lot, but it does happen, especially in school, like in academia, we'll see this. So moving our attention to this other one, what happens is we call it the hypochondriac regions, okay? So like the right hypochondriac region, the chondriac region is referring like the diaphragm. So hypo, below the chondriac, the diaphragm. So you're literally saying the area to the right that's below the diaphragm. Well, that's the liver and the gallbladder, okay? Or chunk of the liver. Versus the epigastric region, that's the stomach. So we hear of patients with like peptic ulcer disease or like an upset stomach that have been vomiting. They'll say, oh, I have epigastric pain. They're talking about literally in the center, okay? Left hypochondriac, it's literally the opposite. Your spleen's over here. And then the right lumbar region, the right periumbilical region, or the periumbilical region, looking here in the middle. Peri means around. So if you around the umbilicus, the belly button, right, that's the region they're talking about. And moving down here, the iliac region, the bones of your pelvis are called the iliac, okay? So they're literally saying right on the right side near the iliac. That's what they're saying. It's like the right iliac region. So that's kind of where this comes up. And then finally, I'm gonna end this slide. I'm on it too much. Hypogastric region, right? So hypo, below the gastrum, right? The stomach. So it's hypogastric. Okay, so that's like your sigmoid and your rectum and your bladder, all that stuff. Uterus, if you're female. So the reason I'm telling you this, and we'll go over this over anatomy because this becomes very important, is we use this diagnostically. If a patient tells you I have left lower abdominal pain, you might be thinking they're constipated, have diverticulosis, diverticulitis, an ectopic pregnancy, blah 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 blah. So you have to know what's up underneath that region and what typically causes pain there and what's the pathology. These are different patient positions. In case you're wondering, this is called supine. This is prone. This is the recovery position. Notice she's on her left side. That's why there's a reason for that. We'll talk about that in gestational pathology. But anyways, this is obviously sitting. So, wow, that's bad. Anyways, yeah, it's different positions of patients. Okay. Now, the reason that I do think you should know these is they'll tell you like your patient's found sitting prone. Well, that's odd for you to find a patient laying face down. Like that's not normal. Okay. Or you place your patient in the left lateral recumbent position. Well, that's the recovery position. So you need to, there's a reason why it's the left. I'll explain that later. But what I'm saying? Like a lot of times in the vignette, they'll explain how you found your patient, or they'll say, one of the answers will be like, how should you position your patient? Believe it or not, positioning of patients is treatment. So they'll ask you that. Now we're almost done. Hang with me. Abbreviations, acronyms, and symbols. Now, these are annoying, but they're here. We can't do anything about them. We're stuck with them. An example is EMT, right? It'd be quite annoying if everyone's like, I'm an emergency medical technician, instead of like, oh, I'm an EMT. So I get the value in that, but people take it to the next level, and they like to be like, oh, they have OPQRST, BBB, and it's like, it's too much, okay? So it has value, but it can also be very confusing. And what you see a lot in the literature is there's so many acronyms, they have to use what's called a data dictionary, where they have to explain all their freaking acronyms because there's so many of them. Some people get out of control with it, especially the government. So just be aware, acronyms and abbreviations, they're like They're shortening of a word. Okay. So, well, one second. Let me explain the difference between these. An abbreviation is pronounced with each letter separately. EMT. Comparatively, rather contrasting, an acronym forms a word like USAR. So it's still Urban Search and Rescue, but instead of having to say USAR, we just call it USAR. That's an acronym because it forms a word. Just throwing that out, could show up on the test. Now, you really shouldn't do this. It's really only widely commonly used ones that we like to use. Now, I will say avoid trailing zeros, but include leading zeros. I'll show what this looks like because this happens a lot. We'll talk about this in pharmacology. So if I tell you to give the patient 0.4 milligrams of nitroglycerin, which EMTs do give nitroglycerin, it would look like this. So this would be written like 0.4 milligrams nitroglycerin. Okay, there's a reason I have that zero there. I'll show you why. If I just wrote 0.4 nitro, right, milligrams of nitro, do you see how someone not paying attention could think, oh God, I give 4 whole nitro tablets? Well, that dose is 0.16. Or I give 4, so that in order to get that dose, I'd have to give 10 nitro tabs? All right, that's what they said, I'll give it. So that's why we use what's called a leading zero. We give it up here. That's a leading zero. It's before the decimal point. Now, also, what we don't do is use trailing zeros. So what we don't want is to say 0.400 nitro, because what happens with that is they'd be like, why? You get 400 nitros or you get 400 milligrams of nitro? No. It causes confusion. The whole idea is to reduce confusion by doing this. So just do that. It's leading zeros. We don't use trailing zeros. Make sure your decimal's clear. Repeat back your order. Those are all best practices. When in doubt, write it out. Okay? Type it out. If you don't know what an ERGD is, right? It's like a procedure. Write it out. Okay? Look it up. Google it. It's okay. It's okay to write stuff out. You will not get in trouble for writing stuff out. You will get in trouble in the court of law and with your agency for not writing stuff out and using slang and acronyms. Never heard of someone getting in trouble for writing something out fully. So just keep that in mind. So these are abbreviations. We don't use these a lot clinically anymore because they can cause confusion, but it's not to say they're not used. I know, I hate contradicting myself like that, but anyways. So like degrees, I'll just show you. So degrees can also, like, see that little zero, like we typically know that as degree. Well, what happens is we can also use that in medicine as like primary. And like, so if I want to say someone has like secondary hypothyroidism, right? Instead of writing word that like secondary, SECONDRY, I could just write 2 with a degrees, and that means secondary. It's really weird, okay? But that happens, so it's just an example. We use Greek nomenclature for a lot of the things like alpha, beta. Beta looks like this. I'm not really good at drawing Greek letters. So we use that occasionally. Less than, greater than, equal than, greater than or equal than, all those things, we use those like these. We do use those. Unfortunately, you see that a lot on lab tests and vital signs and stuff like that. So just be aware, these are all symbols that it's a best practice not to use these, but they are used, especially in academia. So for the most part, medicine's gone away from this because they can be confusing. And the last thing we want to do is confuse medications and practitioners and EMTs and stuff. We don't want to do that. So they're going away, but they're still used occasionally. Now, almost the last slide. So basically, you got to be familiar with these, okay? Like, yeah, I know, just figure it out. But this is just kind of laying a foundation. You got to read this chapter. You need to know the majority of these things. They do show up on exams. I'll tell you, when I went to EMT school, we took an entire college class, or paramedic school, I'm sorry. When it's paramedic school, we took an entire class based on medical terminology, and it is helpful. It is very helpful to where you can pick up the word, like, I'll give an example. Hyperparathyroidism. I could break down that word. Hyper means it's high. Para means next to the thyroid. Oh yeah, there's a gland called the parathyroid that works on calcium, mainly. So I'm saying, that's like an example. You just have to break down the words, and I've given you a bunch of examples, so I'll stop. Now, lastly, there's this system in medicine. This is important. We tend to not use inches, miles, feet in medicine. The reason is the United States and all of our gloriness and self-righteousness, which I love, um, we decide to use this in a system called the imperial system. Imperial. And this is like inches, feet, miles, stuff like that. Okay. We use that in the United States. But literally, I mean, I don't know of any other culture or place in the world that does use this. They all use kilometers, meters, centimeters, millimeters. So who do you think won that fight? Yeah, the people that founded medicine outside of the United States, right? An old country. Um, and so we use the metric system in the United States for medicine. So patients they could tell you their weight in kilograms, and it's almost exclusively you'll get their weight in kilograms. Or when I measure a laceration, I need to report it in centimeters and millimeters, not inches. Or the patient's temperatures in Celsius. So like 38 degrees Celsius is 100.4 degrees Fahrenheit. We don't use Fahrenheit in medicine. We use Celsius. So you're going to see that on your exams. They'll tell you patient's a 100 kilogram, patient, 38-year-old female, and and you have to know that's 220 pounds. So do familiarize yourself with this. One formula I want you to know is it's this, that pounds equals, so if you want to get pounds, you do the weight in kilograms times 2.2, and that'll get you pounds. So I'll give you an example. If someone weighs 100 kilograms, we're going to multiply that times 2.2, and that's going to equal 220, and that's how many pounds they are. Okay? You got to know those. Like, that conversion is actually really important. So that's just an example. Now, I'll end on this. The metric system is actually a whole lot easier to use than the imperial system that we use in the United States, because the metric system is based on tens. So it goes up by increments of like tens or hundreds or thousands or something like that, compared to like, who thought that 12 inches should make 1 foot and like 5,376 feet should make a mile? Like all these weird things. But that's the imperial versus metric system. You do need to know that in medicine, we use the metric system because everyone else in the world uses the metric system. And this is the fight the United States has lost. We use the metric system in medicine. Okay, it's not up for debate. Now, that's it. That's all I have for this lecture. I appreciate y'all's time. If y'all have any questions, reach out to instructor, send us an email, and yeah, thanks for listening.